Hi, my name is Rochelle Guglielmo, and today we will be summarizing a medical report from a paramedic for a patient arriving in the emergency department. The objectives today are to summarize the paramedic's report, to give a report by body system, and to discuss the overall conditions and treatments that are appropriate. So the summary of the report. The patient's name is Don Smith. Date of birth, July 1st, 1985. He was the unrestrained driver in a motor vehicle accident approximately 20 minutes ago. The patient complained of left lower quadrant pain, left arm pain, left leg pain, and head pain. There was no complaint of loss of consciousness or dizziness. Blood pressure 165/84 with a pulse rate of 108. Respirations 24. Temperature of 96.8 degrees Fahrenheit, and an oxygen saturation of 98%. It was noted upon arrival that there was a splint to the left lower extremity and a sling to the left upper extremity. It was also noted that there was gauze wrapped around a head wound with noted sanguineous drainage. Next, we'll move on to the integumentary system. There was a noted forehead laceration with sanguineous drainage, a forehead contusion, ecchymosis to the left elbow, a hematoma to the left knee with erythema present, a hematoma to the left lower quadrant of the abdomen. Next, we move on to the musculoskeletal system. It was noted that there's a possible compound fracture of the left elbow, edema present to the left knee, and the patient also has a history of scoliosis causing kyphosis. Next is the cardiovascular system. There was a blood pressure noted of 165/84. The patient does have a history of hypertension. Patient has a history of hypercholesterolemia. The pulse rate was 108, noting tachycardia. There was no cyanosis noted upon exam. Next, we'll look at the respiratory system. There was tachypnea with a respiratory rate of 24. The patient has a noted history of asthma. No dyspnea noted at the time of exam. Pulse oximetry was normal at 98%. Next, we'll discuss the digestive system. There was left lower quadrant gastralgia, left lower quadrant contusion with erythema, and a history of gastroesophageal reflux. Next, we'll discuss the reproductive system. There were no abnormalities noted of the reproductive organs. There was a pain and contusion noted to the left lower quadrant of the abdomen. History of nephroliths. No testicular torsion was noted upon exam. Next, we'll discuss the endocrine system. There is a noted history of insulin-dependent diabetes mellitus with hyperglycemia. There were no blood glucose levels noted during the exam. Next, we'll move on to the nervous system. There was no loss of consciousness, no complaints of dizziness, mild cephalalgia, which is a headache. No delirium noted on exam. The patient was alert and oriented. No neurologic assessment was noted. Next, we'll move on to the condition and the treatments. There was a possible compound fracture of the left upper extremity requiring orthopedic and possibly total knee arthroplasty. That's the left lower extremity. Head injury, including laceration, requiring neurology evaluation and monitoring. It would be good to obtain a CT scan of the head to rule out concussion. There was edema with hematoma to the left knee requiring radiographs to rule out fracture and possible orthopedic intervention. And there was also left lower quadrant pain requiring a CT scan to rule out any pathology there. There was an increased blood pressure requiring a cardiology consult due to the history of hypertension. And it would be good to check 2-hour postprandial blood sugars due to the diagnosis of diabetes. Thank you very much for your time and attention to this presentation. Have a great afternoon.